5 easy ways to improve collagen in your skin. So one of the ways, or one of the things that we get commonly in clinic is, why is my skin not hydrated? Why is my skin not plump? Why is it not elastic? Why is it dull? Why has it lost its glow? I'm happy to share with you some easy tips to correct that, or to improve it. And also a little recap of last week where I spent a day at the Women's Health Symposium, courtesy of the British Menopause Society. So keep watching. Hello and welcome to another edition of the Vysana Life newsletter. This is Dr. Dhesi, GP, cosmetic doctor and women's health specialist, and I am excited to share with you my weekly tips. If you haven't already subscribed to us on YouTube, please do hit the subscribe button and even hit the notification bell, little bell that's usually in the top left or bottom right corner for notifications when we go and post anything. I said I would share with you 5 easy ways to make your skin hydrated, plump, elastic and glowing. But before I do that, I spent last week a day at the Women's Health Symposium from the British Menopause Society. It was sort of a conclusion to a year of training, principles, foundation principles and management in menopause. And the British Menopause Society had arranged a great group of speakers, really specialists in their field on various elements of women's health, not just perimenopause, menopause, but general women's health as well. I learned a lot, and I'm going to be sharing that with all the patients that come into clinic, also sharing that through private GP appointments. You know, it really has changed the way that I view women's health. So what did I learn? I'm kind of keeping you on the hook here. So firstly, in conclusion, one of the things I learned from the day was that all women's healthcare has to be bespoke. It has to be individualized. Menopause care involves or perimenopause care, whichever way you want to think about it, involves listening. The first thing to do is actually listen to signs and symptoms. Once you really get the story and the relationship built up with the patient, then it's time to think about what sorts of treatment is required. Now, it is always controversial. I am an advocate for HRT. I think that HRT has a foundation in terms of treatment for menopausal symptoms, including hot flushes, cognitive changes, that's like mood changes, memory changes, sleep, the prescribing of estrogen in whatever form and progesterone as well really does help. But it also depends the form that it needs to be prescribed. And that's where individualized care really comes in. So, for example, not every patient is going to respond to a transdermal route. So that's, for example, where you're putting on topical estrogen. You know, you have to sort of tweak it and think about, where am I applying it? In some cases, it's recommended to use estrogen on one area. It helps to build up a reservoir in the subdermal layers of the skin, which then the body can draw on. And in some cases, it's actually better to change where you're putting it on, because that helps with absorption. The absorption of estrogen is critical. We discussed a condition called tachyphylaxis, which is basically that you keep using increasing amounts of medication, but the symptoms of the disease or condition still manifest, and you sort of over-treat and get no effect. I've discussed that in a post before. So individualized treatment is really key. What other things have we learned? Coronary heart disease. Again, the reason why I take blood pressure for all patients coming in, because we want to build up a trend. We want to see what your blood pressure is doing, because coronary heart disease, cardiovascular disease, heart attack, stroke is one of the biggest killers of women globally, not just in the UK, but globally. And just keeping an eye on your blood pressure and using it as a biomarker. So when I say biomarker, it's like this is something that can affect your health in the long term, really brings into focus, what do I need to do to change about my lifestyle? So obviously if weight increases, which can do in menopause, if stress increases, which can increase in midlife anyway, because family, children, job, etc., then monitoring, not daily, but taking a moment to monitor that blood pressure, and not just when you're sitting at home relaxed having a cup of tea. That's probably not the best time to monitor it unless it is running high chronically. I think the best time to do it is when you are in stressful situations, and then you can actually see how stress, how life is affecting something in your body obviously blood pressure. So coronary heart disease was a big one. Different forms of medication, which I've already discussed. When to refer, when to seek specialist help. In some cases, in primary care, we can't always manage some more complex cases for menopausal management, and referring to a gynecologist does help, or referring to a menopause specialist. Another one was, again, prescribing HRT in women over 65. So the research is definitely there in terms of highlighting the benefit of HRT and menopause management within 10 years of menopause. But what about women who didn't go on to HRT, who weren't given the opportunity to go onto HRT because of the Women's Health Initiative? I'll speak about that in a second. That the research isn't there, but increasingly there is more and more guidance coming out. So if you are over 65, you never had an opportunity to go onto HRT, then it's an opportunity to discuss that with a healthcare provider. We obviously can do that in clinic as well. And lastly, I mentioned the Women's Health Initiative. That was discussed as well, about the findings that the risk of breast cancer was sort of misconstrued, misinterpreted, and that resulted in a whole generation of women not getting HRT when it would have been helpful. So a really, really, really good day, and I'm sure there is more that I will share to you as well, because it's about the mantra, mindfulness, menopause, and medicine. So you've been watching for this long. I did promise you, so when your skin is not hydrated, when it's not elastic, when it's not glowing, how do you regain that? So yes, of course, having treatments in clinic really does help. Having injectable treatments like skin boosters like Profilo or polynucleotides really does help to introduce stimulation and direct injection of collagen into the skin, which can help those things. I want my skin to be plump, I want it to be hydrated, I want it to be glowing. But what else can you do? And this is the difference between just coming into clinic, but also having a bit of education about what else you can do. If you would like more information, we do have a kind of bespoke package that we can recommend in regards to all of these tips, but you can do this at home as well. It doesn't require any additional cost if you are being efficient with your time and money. So firstly, vitamins. Vitamins do really help in stimulating your skin. So one of the vitamins I would say is vitamin C, but taken in small amounts throughout the day, not a big dose. Vitamin C is a carrier, a stimulator, it's kind of a building block. It helps the factory process of producing collagen. So definitely a vitamin C supplement every day. Again, taking 1,000 milligrams or whatever the over-the-counter dose is not ideal. Breaking it into small amounts throughout the day is much better. So vitamin C, also zinc, magnesium, these are also vitamins, and vitamin E can also help as well. Obviously trying to get those from foods is much better than taking a supplement, but supplements are available. So that was number one. Another way is to use really bespoke skincare. This is where, again, topical vitamin C can help, using skincare that's rich in hyaluronic acid, but small molecule hyaluronic acid. Hyaluronic acid doesn't just come in one size, it comes in different sizes, kind of similar to people, I guess. And the smaller the molecule, the better it penetrates in and helps to replenish, especially those upper layers of skin. Probably not getting as deep as when we inject it, but definitely peptides, which are carriers and which help stimulate skin, and also hyaluronic acid as well. Another top form of skincare is obviously retinol. Retinol does help to increase cell turnover, and that can help to improve the glow in your skin. Another way to improve collagen is actually to take collagen as well. So let's firstly focus on marine collagen. So marine collagen is a bit more expensive than other forms. I think it's the processing itself. It's hydrolyzed collagen, so it helps with its absorption. Now, you don't just eat collagen and then it finds its way to where it needs to be. Collagen is actually a stimulator, and that then helps stimulate your fibroblasts, your skin cells, to produce more collagen. So taking collagen is actually a stimulating effect. The other form of collagen that's readily available is bovine. Bovine collagen is a little bit cheaper. You'll find, again, very effective. There are lots of different forms of collagen. One of the ones that currently people like, because it's the winter months, is actually coffee creamer. If you want to find out more, then DM us and we can share that information, or comment and I will share that information with you. Basically, taking collagen on a daily basis has been shown to improve. Controversial, I know, there's lots of different studies out there, but definitely I'm an advocate for taking collagen. Continuing on the theme to get that skin glow, the other one is dietary choices as well. So you really need foods that are rich in amino acids and proteins and fats. These can all help to improve collagen synthesis in the skin naturally. And obviously, if you're having the added effects of coming into clinic and also taking vitamins and skincare, then that can really help as well. So one of the things I would say is really, really, really get polyphenols into your diet. Polyphenols are great. They're kind of carrier molecules. They help to transport things or facilitate the transport and absorption of amino acids, hydrolyzed collagen, omega-3s, fatty acids, all those things. So eat foods that are rich in polyphenols. If you want a easy source, then that's olive oil. A good extra virgin olive oil will have plenty of polyphenols in there to help transport and stimulate collagen production. And lastly, another treatment that doesn't involve injectables necessarily is microneedling. So we have different forms of microneedling in clinic, and that can really help to stimulate collagen as well. So if you want glowing, hydrated, elastic skin, if you're wondering why you don't have that, those are some easy ways to produce and stimulate collagen. You really want to target those fibroblasted skin cells to produce collagen and get the skin that you would like. So that is all for this week from the newsletter. As always, this is a conversation rather than a consultation. You should book in for a face-to-face or virtual appointment if you are with a healthcare professional like myself. None of the advice constitutes treatment or medical advice. It doesn't replace the need to actually have a consultation. It's all about education. That's what we're here for. I'm Dr. Sunny Dhesi. This is Vysana Life, and this is another newsletter for this week. I hope you've enjoyed, and I look forward to seeing you again soon. Thanks very much for watching.